iCloud and okay, good evening, everyone, and thank you for joining us. On behalf of Infinity Medical Spa and BIOTE Medical, my name is Nancy Duran, Territory Manager for BIOTE Medical and tonight's host and moderator. Tonight on our panel, we are joined by Jasmine, the owner and founder of Infinity Medical Spa, and our BIOTE certified nurse practitioners, Melissa and Tanya. Our main focus for tonight will be on hormone optimization and supporting our immune system. Before we get started, I would like to bring your attention to the right-hand side of your screen. Please type in your questions, and when we are done with our presentation, we will answer all of your questions. I will now hand it over to Jasmine so she can introduce all of the wonderful services she offers at her spa. Jasmine?
Thank you, Nancy. Thank you, everyone, for joining us tonight. Really appreciate it. And we're really looking forward to the day very soon in the near future to have it all in person and continue with our monthly seminars that we used to have. Before I begin, I would like to thank and acknowledge BIOTE, especially Patty, and of course, Nancy, who we couldn't do without. To give you a little overview on who we are and what we do, Infinity MedSpa is licensed as a medical clinic. Therefore, we are open on a limited basis at this time, booking our essential services, such as bioidentical hormone therapy and IV therapy to strengthen your immune system. As our nurse practitioners will go into details on the bioidentical hormone therapy with you, I would like to add that I have been on the hormones for the last 10 years now, and I don't think I could ever do without them. Not only has it helped me with my energy level, my joint pains, libido, mood swings, but it has also boosted my immune system and protected me against colds, flus, and viruses. When you listen to the presentation, I urge you to think about the time we're presently in and how helpful this treatment could be for you. On top of these services, we offer our platelet-rich treatments such as the Vampire Facial and Facelift, Vampire Breast Lift, Hair Rejuvenation, the O and the P Shot, and the Joint Therapy, where we take your blood, spin it down, and take the platelet-rich plasma and inject it back into the areas of concern, whether it be a medical issue or for any aesthetic reasons. We also offer the popular services such as Botox and derma fillers, the HCG diet, and the plasma pen. On products, we do carry pharmaceutical grade supplements by BIOTE, and also we have a wide selection of medical grade skincare called Skin Medica. You can purchase a Skin Medica either by coming into Infinity MedSpa, or you can get it from our online store on our website. As promised, we're giving away a free bottle of our ADK supplement tonight. So please give us a call. Let us know when you would like to stop by to receive your free gift. Our two wonderful nurse practitioners, Melissa and Tanya, will jointly present an informational overview on how the hormones can protect you during these difficult times. I'd like to thank you again for joining us. Enjoy this informational session tonight, and I will now turn it over to Tanya. Tanya?
Everyone, my name is Tanya, and I am a board-certified nurse practitioner at Infinity MedSpa. And today we're here to talk to you about hormones and what they do, why they're important, and what happens when they're imbalanced in the body. And this imbalance is what we call hormone havoc. And this is especially important in these times when our body's immune system is our strongest suit of armor against diseases such as COVID-19. And we're also going to talk to you about what you can do to determine whether your hormones are imbalanced, and then how you can restore that balance with a board certified provider such as Melissa or myself. And I also just want to mention that hormone replacement has been around since the 1940s. However, it is not routinely taught in medical schools. Therefore, it's not widely practiced by most providers, despite the fact that it's an essential part of our health and immune strength. So hormones are essentially chemical messengers, and they're made by our endocrine glands, such as the testes, ovaries, thyroid gland, and pituitary gland. And they work in a lock and key fashion, meaning that they bind to receptors on cells to cause a response. And hormones control everything in our bodies, from our sleep cycle to metabolism, sex drive, appetite, temperature regulation, and many more. And the fact is that people's hormone levels actually begin to deplete as early as in their 20s and 30s.
Hi, everyone. I'm Melissa. I'm the other nurse practitioner, board certified at Infinity MedSpa. And, after, Tanya gave that awesome introduction. So as you've seen in the previous photos of, the people not looking so great, mood swings and whatnot, which is probably what many of us are, feeling at this moment, being in quarantine and not being able to get out the house or even seeing loved ones and things like that. So you may find yourself being more anxious, maybe depressed or out of sorts, and kind of just feeling like, what to do. And maybe it didn't even start from this point. Maybe it probably started, months, years prior. And you're just kind of thinking that maybe it has to do with the day-to-day wear and tear. But what if it was something more internal? Again, I'm assuming that, we all want to feel happier, better times, but also it's important to focus on being healthy as well. So, do any of these symptoms sound familiar? If not just from today, how you're feeling now, but from even months before we started going into quarantine, having feelings of like extreme fatigue around the 3 or 4 o'clock point, mood swings, such as feeling moody, your husband or your wife kind of just like, getting you over the edge, or your kids or whatnot, or you just seem like you just can't tolerate that coworker anymore. Or you're anxious, not just because of what's going on, but you just find yourself over the top with just the little things like, even frustrated if you lose your keys, having tension, irritability, lack of sleep, waking up in the middle of the night, with anxiety or not really sure what's going on. And also memory loss and depression, lack of focus, brain fog, hot flashes, night sweats, even weight gain and joint pain, bladder headaches, and even decreased sex drive, which many of us think that, okay, maybe it's just what's going on, I'm stressed, but a lot of times it could be because of what's going on in our endocrine function, and maybe our hormones are off. So again, during this time, it's something that we should look into in terms of trying to get us over that period of stress, especially during COVID-19. So here's what we're going to go into and talk further about is the BIOTE method. Basically, we're going to be focusing on the key hormone elements in our bodies that are responsible for many of the, symptoms that I just literally pointed out. So these will include testosterone, estrogen, and thyroid. And then also towards the end, we'll touch upon the medical grade nutraceuticals, which are essential when you're doing BIOTE method, in particular the pellets, because it's only going to help add on to that healthier quality of life and strengthen the immune system.
So the first hormone that we'll be talking about is testosterone and andropause. Andropause is also known as male menopause, and it is common in males, especially those over the age of 50, and also those with chronic conditions like hypertension and diabetes. Andropause is linked to early heart disease, and it is underdiagnosed because most providers do not routinely check for it. Testosterone is a hormone produced by both males and females. When it is repleted to normal levels, it provides major symptom relief and protects bones, breast, and prostate tissue, as well as the heart. It is produced in much larger quantities in males, giving them their masculine features, and in smaller amounts in women. And men start to lose 1 to 3% of their testosterone production annually after age 30, while women can lose up to 50% each year after age 20. So the positive effects of bioidentical testosterone replacement in males and females can be grouped into 2 categories, those that you can see and feel on the left-hand column, and those that provide long-term health benefits against chronic conditions like diabetes, heart disease, cancer, and osteoporosis, as you can see on the right-hand column.
So ladies, let's focus on our women. You may be approaching menopause, or you may be currently trying to manage through it, but guess what? We can help you. So some facts about menopause: it occurs in roughly 3,500 women enter it daily, and symptoms can begin up to even 15 years earlier. And it can affect women in more than one way or another. And it honestly takes, could take women forever to get over and get through menopause completely. And most women don't even get through it without any symptoms. And if it wasn't enough that you have to lose the estrogen, it can affect you in so many different ways, especially if you're a premenopausal woman and you're trying to manage through the fluctuations of estrogen depletion, etc. If 1 out of 7 will suffer from a form of heart disease and die from it, whereas the number even increases in terms of mortality in terms of postmenopausal women, 1 in 3 suffering the consequences of heart disease. So it's definitely something to be concerned of. And in terms of that, estrogen is the key factor in this case, where, you hope to, make sure that you're maintaining a level within your body that's suitable. And it's present in both men and women, obviously in large quantities in women and very small quantities in men. And it's responsible for over 400 functions in the body. Again, kind of what I touched upon earlier. It helps control hot flashes, that bone density. It also helps with our memory and maintains the collagen in our skins. And it also increases those happy hormones in our brains, which is serotonin and dopamine. So especially now, if you're stressed out and you're like, what's going on? It sounds like, many of us could use some of those little happy hormones. Hey, why not, kick up with some testosterone, estrogen in your system? And just again, the positive effects of natural estrogen, it controls those hot flashes. It maintains that, integrity in our skin, those happy hormones, and maintaining that bone density, that bone strength, improves our memories, and also helps prevent a lot of the neurodegenerative conditions such as Alzheimer's, and lowers our cholesterol levels and improves our HDL levels, as well as LDL levels. And again, it's a great protective mechanism for bone, breast, brain, and heart, especially when we're trying, as we age and get older, we definitely want to maintain our youthfulness.
So there are different types of hormone replacement methods, and they are grouped into 2 categories, synthetic and bioidentical. The first hormone that came on the market in the 1940s was called Premarin, and this was a synthetic estrogen pill synthesized from pregnant horse urine to treat menopausal symptoms in women. And the main difference between these 2 groups comes down to safety, and you can think about it like consuming organic versus genetically modified foods. They both do the same job. However, when you use synthetic hormones, your body has a higher tendency to produce active metabolites that can be harmful. When you use bioidentical hormones, you are giving your body a hormone that is exactly identical to what your body naturally produces, and therefore this does not cause harm. So the BIOTE method uses only bioidentical hormones in the form of pellets made from yams. One of the reasons that hormone replacement became so controversial and fell out of favor in the late 90s and 2000s is because of the Women's Health Initiative, which was the first randomized control trial studying hormone replacement therapy. Although it was a randomized, controlled, and federally funded trial costing $625 million, it was a flawed study in many different aspects. This study showed no statistically significant evidence that hormone replacement was harmful. However, the principal investigators still maintained that hormone replacement therapy was linked to increased strokes, heart attacks, breast cancer, blood clots, and Alzheimer's dementia in women. And as a result of that bad publicity, From the study, many providers stopped treating their patients with hormones, and thousands of women were left without therapy. As a result, many women actually died because they were no longer being protected against heart disease, cancer, and other diseases. So why use pellets? Estradiol and testosterone patches are available in bioidentical form. However, they don't work consistently in all people since they depend on adequate absorption through the skin, which varies by individual. This can be a problem due to poor adhesion, sweating, hair, and skin sensitivity in some people. They do need to be changed weekly, and although they work better than oral pills, they are not as effective as pellets. Creams and gels are also available in bioidentical form. However, they must be applied daily at also consistent doses, sometimes multiple times a day, and they also depend on adequate absorption, which varies by individual. There's also a risk of transferring the hormone to others in the home, like children and pets, and they do not protect the bones, heart, and brain, unlike pellets. And injectable testosterone is also widely used as a method of replacement, particularly among males. And the biggest downside of using injectable testosterone is that it is 99% synthetic and therefore can have significant adverse effects such as liver toxicity and cardiovascular disease. Likewise, there's often a roller coaster effect in blood levels of testosterone, which can cause an unwanted aggression and agitation because it wears off before the next dose.
So I guess you're wondering, is there a benefit in me getting pelleted? And if you're still thinking that after hearing this, I'm about to provide you with some more information. So remember, these hormones, pellets, are natural plant-derived compounds. They literally come from the yam. If you're familiar with that, something that we eat every day at Thanksgiving. They extract the cholesterol molecule, and it's converted into a natural safe hormone therapy, which is the estrogen and testosterone pellet. And it's the same molecular structure as human hormones. And it lasts longer than any other treatments that Tanya just mentioned in terms of the patches, creams, and injections. And it averages between 4 to 6 months. And again, it's the most widely studied form of bioidentical hormone replacement therapy, literally for over 8 decades, and provides a steady stream of hormone in the blood. And it's individual dosing. Again, we do your baseline labs prior to any pelleting and throughout the course of your pelleting lifetime insertions. And it's implanted under the skin, so only you would even know where it is. And it's not even visible to the naked eye. And just some history, a little bit of why the pretty much hormone therapy came into place. Pretty much back in the 1939, women were having radical hysterectomies, as a form of trying to treat the menopause. But why not, try to find something simpler to deal with? So they came up with different treatments, such as with estrogen and testosterone. They found that the pelleting was obviously the most natural, effective use. And again, it's been used for over 80 years in various areas all over the United States and all around the world. And various studies have been conducted showing time after time again that estrogen and testosterone pelleting is the most effective, safe, and natural way of maintaining and keeping our bodies in optimal shape. And as you can see here in this graph, it just basically kind of reiterates what Tanya was discussing previously. Like the different techniques of hormone therapy, they're not all the same. And especially as you can note here, based on estradiol, a form of estrogen that's released in our bodies, implants, which is highlighted in green, which is what we're labeling as pellets, versus the patches or oral treatments, which are patches in orange and oral treatments in purple. You can see the consistency in implants with pellets as opposed to if you were orally treated with birth control or via the patch, where there's that inconsistency. So you don't know if you're absorbing right in terms of having the patch on you. And also if you're in oral intake, if you're taking the pill the correct time of day, or if you're skipping, etc., or just if it's not absorbing right in the body, if you're combining it with other medications and things like that. So as you can see, you want to, if you're going to go, you know, you go for hormone therapy, you definitely want to go with something that's consistent, that's going to benefit your body, and that there will be no fluctuations, because again, that will contribute to, you know, the signs and symptoms that you would be feeling if you have elevated or decreased levels of estrogen in your body. So again, why is BIOTE method of pelleting, you know, the way to go? Again, it's important. You know, it helps our body return to the normal hormonal balance and physiological state, especially when we're trying to get those testosterone levels back up to par. So, you know, during these times, again, you know, when we're not feeling well and we're trying to, you know, figure things out, and we're stressed, and, you know, eating everything, we're gaining that weight because we're stressed out. It's all like a kind of goes in a circle and things like that. You know, it's important to kind of go back to the basics and figure out what we can fix to get our bodies back into shape. Because again, the more that we work on trying to balancing our hormones, the more it helps to strengthen our immune systems, especially during these times of the pandemic. So it's all about finding the right hormone balance, which is again, bioidentical hormones, and getting the right estrogen, testosterone in our systems, the right amount of dosing, which is again, individualized. So it's based on the labs, again, that we do when you come in for your consultation, and then throughout the whole pelleting procedure, you know, post-op, things like that, just because we want to make sure that you're getting what you need and you're feeling what you need to feel. And also the right delivery. Again, we're giving you something that's consistent and reliable, and that has been backed up by studies for several years. And we're talking about years. And that, you know, it's been a proven track record to only serve a quality method of hormone therapy.
Breast health is going to be our next topic of discussion, and there have been multitudes of studies that have shown adequate hormone balance is protective against breast cancer in both men and women when delivered in pellet form. Hundreds of breast cancer studies have shown that testosterone pellet implants do not increase the risk of breast cancer, unlike oral synthetic methyl testosterone. This is mainly due to the fact that when synthetic hormone is taken orally, it passes through the liver, creating active metabolic byproducts, which can be harmful to the body. This does not occur with pellets. And the most interesting thing is that studies have shown that treatment with testosterone and estradiol pellets do not increase the risk of breast cancer, even in breast cancer survivors. Also, estrogen alone does not increase the risk of breast cancer. And all of this data is from studies that are referenced at the bottom of the slide. One of the biggest benefits of hormone optimization is bone health, which we'll talk about now. Testosterone and estradiol are bone and muscle builders in the body, protecting against osteoporosis. Studies have shown that estradiol pellets increase bone density by 8.3% per year, which is 2.5 times more than patches and 4 to 8 times more than oral estrogen. Another important message here is that the maximum benefits of hormone replacement is seen when individuals start earlier. Once someone is in their 80s with advanced osteoporosis, the benefits of hormone replacement are not as potent as if they started in their 40s. Osteoarthritis is also a leading cause of disability in Americans and affects 10% of men and 18% of women over 60. Both testosterone and estrogen stimulate pre-cartilage cells to make new cartilage, collagen, and hyaluronic acid in the joint spaces.
So to look for additional, so if all that information wasn't enough, so look at additional incentives to maintaining your hormone levels. It can also help decrease long-term effects of hormone depletion in our brains. So unfortunately, women get Alzheimer's disease 8 times more than men, and women with estrogen levels that are 50% less, that have estrogen levels that are 50% less likely to develop Alzheimer's disease. If they have adequate, excuse me guys, if they have adequate estrogen levels, are 50% less likely to develop Alzheimer's disease. And the same goes for men with low testosterone levels, are 3 times more likely to develop Alzheimer's disease. So the key idea here is basically the more adequate and the higher your estrogen and testosterone levels are, the more that you're saving your brain for those long-term effects of neurodegenerative diseases. And especially during these times, heart health is important. especially since, you know, there have been studies done showing that, you know, cardiovascular diseases are contributing factors towards worsening conditions once you've contracted COVID-19. In women, estrogen replacement with pellets has only showed positive effects on body fat in postmenopausal women, as well as improvement in their lipid panels. As noted here, most women notice a decrease in their total cholesterol and LDL levels, and also an increase in the HDL level, which is the good cholesterol, and also a decrease in triglycerides. And by adding testosterone in the mix, it doesn't mean, it doesn't harm estrogen levels in any way. In fact, it's just an added bonus on the effects of LDL cholesterol. It actually improves it. And there's also been a marked reduction in fat mass when women both had estrogen and testosterone grouped together after 2 years. And many studies, again, have showed the effects of natural testosterone on the heart as well. So it's not just estrogen that's a key factor, but also testosterone that's been really beneficial for women. And as you can see below, there are the studies that have been conducted in the past, among many others. And the same idea goes in for men as well. Men, when they increase their testosterone levels in the body, it's helped to decrease the total cholesterol and LDL levels, as well as improve the HDL levels and decrease the triglyceride levels. And again, with this testosterone, it only helps to reduce fat in the body and also improve the lean body mass. And especially now, because if you guys are out there, you know, not, you know, eating more, not working out as much, this would be definitely a good time to get that boost in your system. And again, it's only beneficial to get your hormone levels up to optimal amounts, because again, it's only beneficial to the body and overall quality of life.
So the key facts to take away tonight are that hormone imbalance can start as early as your 20s, and not all therapies are equal. Even normal lab values may still be suboptimal in some people, so treatment is individualized using our BIOTE protocols and based on a comprehensive clinical assessment, lab work, and review of symptoms by one of us, a certified BIOTE provider. And we really encourage you to come in for a free consultation, especially now, so that we can optimize your health and immune system to help protect you as much as possible.
So just again, to go into the nutraceuticals that we offer here with the pelleting, which is essential, you definitely want, you know, to put this in the mix, because again, it's a wide range of vitamins and minerals that are essential for our daily activity. Because again, I don't know about you, but, you know, I don't find myself being able to eat, you know, all my vegetables and fruits and et cetera, and getting everything that I need in terms of what, you know, that's recommended for me. So it's awesome where I can do something where I'm maintaining my health and getting better quality of life. And it's something that I can do, easy to go, pop in my mouth and go on my way, especially during these times when, you know, it's important for us to be wearing our masks, washing our hands, and also practicing social distancing. But we need to work on maintaining our immune systems as well. Again, and with, you know, as with all our nutraceuticals customized for the bioidentical hormones, we basically, everything that we're providing to you is based on your lab results as well. So we make sure that we're not giving you too much or too little, and we want to get you to the optimal amount. And just to touch upon one of them, the nutraceuticals, as Jasmine mentioned in the beginning, that will be offered to you free just for joining us on this webinar. You're more than welcome to call in and come in and stop by and pick it up, and we'll have it available for you, and we can further discuss your BIOTE experience. But vitamin A is definitely, vitamin ADK is an essential nutraceutical that everyone should have on board. As you know, just the key components, vitamin A is a beta-carotene, which converts into retinol. And, you know, as you're familiar with, it's in carrots. And studies have shown that it offers protection and ability to fight off various infections, such as measles, pneumonia, malaria, even HIV and lung diseases. And this actually can be used, you know, people have been starting to supplement during this COVID-19 period of time. And especially with the addition of vitamin D, which enhances host defense against infections and against cancers. And it also helps dampen the autoimmune response. And by combining that with vitamin K, which is helps with blood coagulation and also the binding of calcium in our bones and other tissues, with that 3 power punch pack, what we're doing is we're essentially creating like a force field in our bodies against like, you know, harmful viruses or diseases and things like that, that try to invade our spaces. And, you know, what's an awesome thing to do if we have something in the palm of our hands that we can give ourselves on a daily basis with that doesn't take any more than a moment and a glass of water, just to, you know, reinforce and strengthen, you know, our inner core and our being, to live happier, healthier lives. So again, I just want to say behalf on me and Tanya and Jasmine at Infinity MedSpa, we just want to thank you so much for taking the time to listen to our webinar. And thank you so much to Nancy and Pam for putting this together. Please feel free to visit us on our website and call us, definitely call us to schedule a consultation, an individual one, so that we can further discuss, you know, how you can live a stress-free, happier and healthier quality of life. Especially, again, it's essential. I hope the information that we provide for you in this presentation, you know, touched upon things, because, you know, again, this was a lot of stuff that, you know, people weren't aware of, and maybe you were misled, you know, due to past educations or understandings of what you got knowledge from your own providers. Not to say that they were wrong, it's just sometimes we just need to look outside the box and learn and look for different solutions. So again, I'll just end on this last note. Only you can prevent yourself from being happier and healthier. So I look forward to seeing you soon, me and Tanya.
Thank you, guys.
Okay, Tanya and Melissa, we do have a few questions that came in. So Tanya, let's see. First question, how do we get started, and what would be the next step for me to start on hormone replacement therapy?
Great. So the best thing that you can do is you can either come in to Infinity MedSpa. We are currently open, or you can schedule a virtual consult with myself or Melissa, and we can review kind of your symptoms, speak to you on an individual basis about what would work best for you. And then eventually we would need to get your lab work. And then after that, we can kind of have a better treatment plan for you and go over, you know, what would benefit you, what kind of replacement you would need, and things to expect.
Okay, let's see. We have another question just came in. Melissa, how long will it take for the pellets to get into my system?
That's a good question, Nancy, and whoever provided it. Honestly, it varies per person. Again, we range, you know, some people start feeling the effects within a week. Some people, it takes a little bit of time. Again, it's individualized. Everyone's different because, again, that comes into play, like if you're on certain medications, if depending on what's going on with your blood levels, things like that, and making sure that we didn't go into detail in terms of the other things, such as thyroid hormone, which we can obviously discuss on an in-depth level for those of you who are further interested, which I hope it's all of you. But there's different parameters that come into play. So honestly, everyone's different. But again, from the people we've pelleted, they all feel something, they all feel good. And it's just, honestly, we take that on an individual basis. And one thing I want to just make sure I mentioned, this is not, age is nothing, is just a number in this case. The earlier you start, the better. So, you know, a lot of times you're seeing this, you know, think we're just touching upon menopause or andropause and thinking that, oh, you know, I'm not there yet, I'm not old enough. Again, the younger you start, the better. The youngest that we can pellet is 20, 21. So again, and remember, this is something that you're doing for prevention for the future, and also stuff that you're helping to heal you and during these current times as well. So again, age has nothing to do with it unless you're, you know, obviously under 21. But again, it's important for you to be those preventative measures. And also you could be feeling these symptoms even early on in life in terms of the moodiness and weight gain, things like that, and be thinking that maybe it's just me eating too much, or maybe I'm just stressed from work, and you could just be off in your hormone levels. So why not just get your labs checked and go from there and let us take care of the rest?
Beautiful, beautiful. Tanya, another question. I have fibroids, so too much hormones is a detriment to me. How do I go about treatments?
Sure. So the BIOTE method has a protocol for treatment of fibroids, and you would still be a candidate to receive hormone replacement even if you do have that fibroids. So again, we would speak to you on an individualized basis, go over your medical history, do a comprehensive assessment, go over your lab work, and you would still definitely be able to get pelleted.
Beautiful. Another question, are pellets FDA approved?
Sure, is that for me?
Sure.
Yep. So all the components of the pellets are FDA approved, and the pellets are made at an FDA approved site.
Okay. Melissa, will pellets help me lose weight?
Duh. No. So yes, pellets, honestly, they help with weight loss in terms of helping decrease the fat and help you build that lean muscle mass. So again, when you're working this out, again, the estrogen and getting your estrogen testosterone levels back at optimal, you're going to lose the fat, and you're going to build that muscle, that lean muscle. So in terms of that, yes, it's definitely a helpful component in terms of that. And remember, everyone's a different individual basis, and men and women are different, okay? I just want people to keep that in mind, but it's definitely a positive incentive in terms of getting your hormones up to par.
Okay, and one last question. Will I need to take any other medications once I start with the pellet therapy?
I'll take that question. So depending on whether you're a male or female, you may need to take additional medication. Specifically, I can give you an example for women who are on estrogen replacement and who have a uterus. Those women need to take progesterone because that will protect you against getting uterine adenocarcinoma. So there are certain instances where you do have to. There are some instances where you don't necessarily have to. And again, we'll discuss that with you in consultation.
Fantastic. Well, that seems to be it for the questions tonight. Anyone else out there have any other question before we wrap up? Just let's wait here a few seconds. That was a great presentation. Thank you, Tanya. Thank you, Melissa, and thank you, Jasmine, for having such a beautiful spa wellness area where everyone can come and feel strong and healthy and beautiful at the same time. So having said that, on behalf of Infinity Medical Spa and BIOTE Medical, we thank you for sharing with us tonight. Please stay safe. Please stay well. Call Jasmine, call Tanya, call Melissa, set up your procedures today, and I wish you all a beautiful good night. Thank you.
Good night. Thank you, guys.
Thank you.